How to use expanded notes. Expanded notes allow you to create customized critical alerts or reminders which will appear as color indicators on the client dashboard. These make staff and physicians aware of important actions that need to be completed in support of the patient care. In order to create an expanded note, you must first enable the expanded note feature. To enable the expanded notes feature, you click on Setup, then Program Setup, click Windows Toolbar, and check Use Client Dashboard. Click Apply, then OK, and you will be returned to the client card. To create an expanded note, click on the Notes tab, then at the bottom left, click on the New Notes tab. Here you will notice 6 columns. Under Type, there is a drop-down list of 7 categories where you can create your reminders or alerts. The Color column offers 8 color choices that can be assigned to each reminder or alert. The start date is used if you would wish to track the time the alert commenced. End date is used if you wish to discontinue the alert or notice at some point in the future. For instance, if we are notified that our patient has lost a loved one, we would make an expanded note to reflect bereavement and set an end date for 6 months later. This enables staff to be aware that the patient is going through a difficult time, and as such, behaviors or attitudes may seem different when they come for an appointment. Pop-up determines if that alert will show every time the patient information is opened. Yes if you want it to show, no if you don't. Notes described in the definition or purpose of the alert or reminder. Keep it simple. Before you decide to use the Expanded Notes feature, you must sit down at an office and decide what color coding and descriptors you want to use for alerts or notices under each category type. These alerts are being defined for your needs. What works for one office will not work for another. It is also important to remember the more colors and definitions you create, the more difficult it will be for all staff and physicians to remember. Some offices choose to develop quick reference sheets that are kept at their terminals to assist with this. Each of the categories under Type have the potential of creating 4 color-coded alerts that, properly managed, will be reflected on the client dashboard screens. This advanced process will be discussed in another video session. To demonstrate how to create an expanded note, we'll use the earlier example of a patient whose family member has recently passed. To create an expanded note, use the following 7 steps. 1. Under Type, choose the category you need the expanded note. If you wish to have the alert appear on every category window, choose the All option. Otherwise, choose the category appropriate to the window in which you would like the alert to appear. For example, we have opted to use the All category as we want to ensure that the notice appears on all windows that the staff and physicians open. 2. Choose the color as per the defined coding that your office has developed for alerts. In our office, bereavement is color-coded green. 3. Choose the date you wish the alert to start. This is not necessary unless you want to end date the alert. As we do intend to end date the bereavement, we will start date as of today. 4. Choose end date for the date you want the alert to stop. In our office, we have decided the bereavement notice will remain flagged for 6 months. 5. Choose pop-up yes or no option. Unlike the critical note feature that mandatorily pops up every time the client's entry editing window opens, you decide whether or not you want the expanded note to open every time. 6. Enter a description of the alert as per the defined coding your office has set. You will see later why it is a good idea to keep these brief and simple. 7. Click and save for each alert reminder you create. Now that we have created this alert, when that patient comes into the office, the staff can quickly see that the patient has an alert regarding bereavement on every category window. They can identify the alert either by the color code, in our case green, or by hovering the cursor over the green square that shows the expanded note. As we mentioned earlier, by using a brief description, we have helped to keep the descriptor bubble small but understandable. Remember, these alerts are used to provide important reminders to your team to help them ensure your clinic can provide safe, effective, and quality care to your patients. As will be demonstrated in the advanced training video, overuse of these alerts can become very confusing and can cause them to either conflict with one another or to even go unnoticed. It is therefore strongly recommended that you use them with discretion.